Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, which of the following is a cause of luteal phase defect? Progesterone is inadequately secreted is a cause for luteal phase defect. Then, Smita is a case of infertility, which is what is the right time in her menstrual cycle to do endometrial biopsy. 20 to 22 days is the right time to do endometrial biopsy. Then Fern test is presence of NaCl under not progesterogenic effect. Fern test is presence of NaCl under estrogenic effect. Fern test is presence of NaCl under estrogenic effect. Then drugs used in ovulation induction are clomiphene citrate, gonadotropins and letrozole are used in ovulation induction. Anti-hormonal substance used to induce ovulation is clomiphene citrate is the anti-hormonal substance used to induce ovulation. Then a patient used for infertility with treated for infertility with clomiphene citrate presents with sudden onset of abdominal pain and distension with ascites. The probable diagnosis is infertility with clomiphene citrate presents with sudden onset of abdominal pain and distension with ascites. So this abdominal pain and ascites are due to hyperstimulation syndrome, which is seen as side effect of clomiphene citrate.
thank you and thank you for watching.